afternoon, wonderful listeners, and welcome to another informative edition of Health Monday, the program where we get to discuss health issues that affect everyone, irrespective of our age, our occupation, educational background, or even our social status. My name is Precious, and it's always a pleasure to spend this time with you every Monday as we learn, and equip ourselves with the right information that concerns our health. We all know that health is wealth. You can have money, fame, success, a beautiful houses, expensive car, but without good health, without living an healthy life or healthy choice, enjoying these blessings become difficult one way or the other. That is why health education remains one of the most important investments anyone can make. Today's topic is one that has generated a lot of arguments for generations, especially here in Nigeria and across Africa. Our discussion today is traditional medicine better than modern medicine? This is an interesting conversation because almost every family has experienced both, and almost everyone in the entire world has something to say. As you know, many of us grew up with our parents or grandparents giving us herbal medicines or remedies whenever we had a little stomach ache, fever, cough, and body pain. Some people still strongly believe that herbs are what cures illness faster than the modern medicine. Others insist that the modern medicine are better and safest way to go about treating yourself, and also relying on science, laboratory tests, and of course improved medicines. Some people even say our forefathers survived without hospital. Others will respond, if modern medicine wasn't effective, why do people rush to hospital during emergency? So today we are going to carefully examine both sides of the discussion. We will answer questions like, what exactly is traditional medicines? What is modern medicine? What are the advantages of each? And of course, what are the disadvantages? Can both work together? Why do some people prefer herbs? Why do some people trust hospital more? Why do herbal medicines are safe? Because are they natural? Should traditional medicine be regulated? At the end of today's program, you will have a better knowledge and be better informed to make wiser decisions about your health. Remember, this program is for educational purposes and should never replace professional medical advice. So grab your notebook if you have one, stay relaxed, and let's begin today's discussion. If you're just joining us, whether you're joining us live on YouTube or you're joining us on Facebook or you're joining us on the online garden, you're welcome. And the program currently ongoing now is Health Program. Please do well to follow us on Facebook and YouTube so that you get updated when we have various programs for different days. Firstly, we're going to move to the first segment that says understanding traditional medicine. Before comparing traditional medicines with modern medicine, we must first understand that traditional medicines really means what it really means. That is that traditional medicine refers to healthcare knowledge, skills, and practices that have been developed over 100 or even thousands of years, within different culture. These practices have passed from one generation to another. Unlike the modern medication or medicine, which is taught in medical schools and universities, traditional medicine is often learned through family tradition, apprenticeships, and cultural experiences. Some traditional medicine could include herbal remedies, roots, leaves, bark from trees, fruit seed, oil, massage therapy, traditional bone setting, steam therapy, spiritual healing in some communities. While many Nigerians are similar with herbs such as bitter leaves, neem leaf, scent leaf, ginger, garlic, turmeric, cloves, aloe vera, and even moringa. These herbs have actually been used from different generation to another generation to treat various illness. For instance, many people think that drinking ginger tea relieves coughs and sore throat. It is same with taking a bitter cola. There is this conception that it helps to clear your throat of catarrh, probably cough, and even a damaged voice or a lost voice. Other people know that aloe vera is commonly applied on burns and skin irritation. Neem leaves are traditionally used to relieve malaria symptoms. This shows that traditional medicine has contributed greatly to healthcare throughout history. But however, it is important to understand that not every traditional remedy has been scientifically tested. Some may work and some may not work. Others may even be harmful. That is why caution is very necessary. Now, understanding the modern medicine. Now, let's talk about the modern medicine. Modern medicine is healthcare that is based on scientific evidence. Before any medicine reaches the public, the researchers have actually spent years studying it. The process involves laboratory research, animal studies, human clinical trials, safety testing, government approval, continuous monitoring after release. These processes helps determine, is this particular medicine effective? What dosage should be used? What are the possible side effects? And who should avoid taking it? Can it be combined with other medicines? Doctors also don't simply guess illnesses. They must carry out proper diagnosis using blood tests, urine tests, scan, X-ray, CT scan, MRI, ultrascan, and of course physical examinations. These allow doctors to identify the exact causes of a person's illness before treatment begins. Modern medicine has helped humanity overcome many deadly diseases. Vaccines have drastically reduced diseases like polio. Antibiotics have saved millions from bacterial infection. Insulin have allowed diabetic patients to live longer. Blood transfusion have also saved accident victims. Surgery repairs damaged organs and removes dangerous tumors. Without modern medicine, life expectancies worldwide would likely be much lower than it is today. to the next segment is while many Nigerians prefer traditional medicine, there are several reasons many people continue to rely on the traditional medicines. People say it is cheaper. Many herbs can be collected from farm, bushes, or local markets even without spending much money. I can easily walk into my farm and pluck one or two leaves and pound them together, and that's an herbal medicine. Some say easy access. Some rural communities have little or no healthcare service provider. So, like I said earlier, it is cheaper to get. I'll just walk into my farm, get bitter leaf, get sane leaf, blend both of them together, extract the juice, and that can work for malaria. Some people say so. Another one is cultural beliefs. People naturally trust what their parents and grandparents have used, and it's become successful. Some even go about with personal testimony. Many individuals claim that they recovered after using herbal remedies. Another reason is fear of hospital. Some people dislike injection, surgery, or expensive hospital bills. So this reason explains why traditional medicine remains popular today. Now coming down to why many people prefer modern medicines. Modern medicine also enjoy a numerous public confidence. Why? Because it offers accurate diagnosis, emergency care, safe surgery, vaccine, and of course prescription medicines, intensive care units, professional monitoring, and of course doctors also keep medical reports that helps patients to monitor their health over time. Imagine someone who has diabetes. Without proper monitoring, the disease could silently damage the kidney, the eyes, and the eyes. It has a lot of complications that even if you do not monitor it well, it leads to several complications. Another advantage is emergency response. If someone has severe bleeding after accident, I don't think any herbal remedy can replace emergency surgery and blood transfusion. So hospital remains essential in saving lives during emergencies. I know a lot of questions coming to your mind is, can traditional and modern medicine work together? This is perhaps the most important part of today's discussion. Many experts believe that traditional medicines and modern medicines do not necessarily have to compete. Some say they do not compete. Instead, they can actually complement each other, provided traditional remedies are carefully researched, tested, and safety for use under proper guidance. Some herbal medicines have inspired modern drugs. So, however, not all herbs are harmless. Some herbs may actually interact dangerously with prescription medicine. Take for example, a patient taking medicine for an high blood pressure should not suddenly begin drinking unknown herbal mixtures without consulting a healthcare professional. Pregnant women especially should avoid taking unverified herbal preparations because some may become very harmful to the unborn baby. Children should never be given herbal medicines whose ingredients are unknown. The safest approach is to discuss any herbal remedy with a qualified healthcare provider. Moving to the next segment are the common myths that people have about traditional medicine. Now let's clear up some misconceptions. Myth one is that natural means safe. The truth is that many poisonous plants are natural. Safety depends on proper identification, preparation, and dosage. Another myth is that some people say Taking herbs have no side effects, but some herbs are actually very dangerous and they can damage your liver, kidney, or stomach if misused. Another myth is that some will say hospital medicine are always fake. How do you know? Were you in the production room? I doubt. The truth is that medicine actually approved by health authorities undergo rigorous testing. So, however, counterfeit drugs do not exist, which is why people should buy medicine from licensed pharmacies and hospitals. Another myth is that traditional medicine cures every diseases. For example, someone that has diabetes, and you think that okay, I can mix bitter leaf, I can get bitter leaf, scent leaf, blend them together, extract the juice, and take it into my system. I don't think that is a very advisable thing to do. You need to visit the hospital, visit an healthcare service providing station where your condition can be properly monitored, diagnosed, and given the appropriate prescription. You know, when you're trying to monitor and control high blood sugar, you take care of your diet, you watch your diet, you watch what you take in, you practice healthy living, you take fruits and vegetables, if you can, you exercise your body on a daily, you go for regular checkups. So taking in bitter leaf juice with probably a little bit of scent leaf can equally be like you actually eating the soup itself. That's also something that can give you an high risk of your high sugar skyrocketing, which is not very good. The truth is that there is no single treatment that cures every illness. Anyone making such a claim should be viewed with excessive caution. Before we end today's program, here are some important health tips I'm going to throw out there. One is that you should never diagnose yourself based on symptom alone. If you've been following us on our Health Monday program every Monday from 3:20 to 3:40, you will know that I usually I've made a program where I said we should go for a regular health checkup. Go for a regular health checkup. You don't just have headache and you say it's malaria. I can go to a pharmacy and get Panadol or paracetamol and it will go. You cannot just start saying it's malaria. My friend mixed bitter leaf and scent leaf and she was okay. Do not diagnose yourself based on the symptom only, because after diagnosing, we're definitely going to practice self-medication, and self-medication is something that is not advisable for someone to do. Another health tip is that we should avoid buying on label herbal mixtures. Those herbal mixtures that they sell in a transparent bottle that does not have any label. It's just this one is going to go for your malaria, it's going to go for your headache, it's going to go for your back pain. They're not advisable. Read medicine's instruction carefully. A lot of people purchase malaria drugs, the type that you have to take maybe two in the day, two in the afternoon, or two in the evening, or probably two in the day and two at night. But because they want the drugs to, they say, okay, it's actually going to do, going to go fast if I take morning, afternoon, evening. So they give themselves dosages that are even higher than what they are supposed to give them. It is advisable that you read your medicine instructions carefully. Another tip is that you have to complete every prescribed dose of medication. Avoid skipping your medication. If you're told to take a drugs morning and in the evening, please do so. Do not take in the morning and then probably you got so busy and lost track of time and you're like, I cannot take that drugs again, I'll take it the next day. Please and please, it is advisable not to. I feel it's actually better to take it late. Probably a dosage was for 6 a.m. and 6 p.m. It's better you take it around 6:30, 7 p.m. rather than skipping it and expecting that, oh, I will take it the next day. Another tip is that you should don't stop taking prescribed drugs because you feel better. Yes, this is what I've said earlier. A lot of people are going to take drugs and are like, the headache has gone. I'm not feeling stressed again. I'm not having that back pain. And then suddenly feel relaxed and they don't want to complete the medication or the dosage. Please and please, it is not advisable to stop your prescription or stop your medication halfway. Another tip is drink enough water. Take for example, we all know we are in the planting season. Everyone is busy planting tomatoes, pepper, corn, one thing or the other. Your farm needs fertilizer. Your farm needs proper watering. Your farm needs proper sunlight for production of photosynthesis. So does your body needs good dieting, good food, regular checkup, and of course enough water. Please and please add water to your meal schedule, stay hydrated. The next thing is to eat fruits and vegetables daily. Yes, eat fruits and vegetables daily. Even the most affordable fruits like oranges, for example, now we are in the mango season, and of course, yes, in the citrus season, that's the tangerine and the orange. Purchase those fruits, take them into the body, stay healthy. You're cooking a portion of rice. We all know rice is high in carbohydrates. Please add a little vegetables to your rice. It could be the vegetable called ugu leaf or pumpkin leaf as popularly known. It could also be the scent leaf. A little vegetable is okay for your food. Even the beans. A lot of people say beans is protein, beans is protein. It is actually protein in some way. It's also advisable to add vegetables to your beans. Add a lot of crayfish. You can be preparing your rice on one hand, preparing your beans, or even preparing your fish. Make sure your food, your diet are balanced. Another thing is to exercise regularly. You don't have to go to the gym, you don't have to pay for exorbitant fees just to exercise regularly. You don't have to get money to get a gym outfit or register yourself in a popularly known gym, or that little house chores you do, the bending down to sweep your house, the washing of the dishes that you do with your hands, a little dancing, that strolling that you say, oh, I'm just strolling, I'm just walking from year to year. You are definitely exercising yourself. You don't have to do something so rigorous or extreme, too stressful before you can define it as exercise. The last tip is you should please go for routine medical checks up even when you feel healthy. In one of our editions for Health Monday, we've talked about going for proper regular checkup. It is important. When you go for proper health regular checkup, you check your body for any hiding illness or even the ones that have been in your family for like many time and it hasn't like showed itself. Proper regular checkups can help you detect little tiny bits of health issues. It says here, go even when you feel healthy. There are some illness that will not show on your body. You can still be going your daily activities and you don't know that something is wrong till a day will come and you feel burnt out and probably break down. It is not advisable to wait till then. Always visit the nearest healthcare providers or nearest hospital for your daily routine. Remember, prevention is always better than cure. So, as we conclude today's edition of Health Monday, let's return to our question. Is traditional medicine better than the modern medicine? The answer is not a simple yes or no. Both systems have strengths and it also has its limitation. Traditional medicines have saved humanities for centuries and continue to offer valuable remedies, especially when backed by scientific evidence. Modern medicine has also transferred healthcare through research, accurate diagnosis, surgeries, and life-saving medicine. Rather than seeing them as enemy, the goal should be safe, effective, and evidence-based healthcare. If you choose to use herbal medicine, make sure it comes from a reliable source and seek professional advice too, especially if you're pregnant, elderly, living with a chronic illness, or already taking prescription medicine. At the end of the day, the most important thing is not whether a treatment is traditional or modern. The question should be, is it safe, effective, and appropriate for your condition? Thank you for staying with us throughout today's edition of Health Monday. I sincerely hope today's discussion has helped you understand both traditional and modern medicine better, enabling you to make informed decisions for yourself and your loved ones at large. I remain your host, Precious. Until we meet again next Monday, remember your greatest investment is your health. Eat well, exercise regularly, sleep adequately, manage stress, stay hydrated, and never ignore any signs of illness. Have a wonderful week ahead. Stay healthy and God bless you.